you're joining me on live, you're welcome. So, kind of curious to ask some persons is vasectomy the same thing as castration? Like, when they castrate an animal, if you have seen a castrated goat before and you see a goat that is not castrated, at least you see the difference. A castrated goat is more, let's say, has more volume in body fats than a goat that is not castrated. So back to us women, human, like men, is vasectomy the same thing as castration? For those of you that don't know what vasectomy is, I'll be explaining what vasectomy really is in this live video. Now, when it comes to family planning, we focus more on women. What about you? What's you about her for dinner, dog? I don't know. We don't have dog here. I don't have dog. There's no dog in this house. I don't like dogs, but if maybe we'll have dog, it will be for security purposes. So now, vasectomy, for those of you that don't know what vasectomy is a form of family planning for men. Because when we talk about family planning, we focus more on women. Some of you don't really know that men have their own family planning. Now, vasectomy is a procedure where they cut the tube that carries sperm from the vas deferens to the ejaculating duct. Now, you need to understand that vasectomy is not the same as castration. Vasectomy, you ejaculate semen, but there will be no sperm in that semen. Now, you need to understand that vasectomy, for you to understand vasectomy, you need to understand that sperm is produced in the testes first. During men physiology and men reproductive physiology, sperm is produced in the testes. Then from the testes, it is transferred to the epidermis. It is in the epidermis where sperm is matured and stored. Now, during sexual arousal, during ejaculation, when you are sexually active, so the epidermis contracts and pushes this sperm to the vas deferens. The vas deferens carries this sperm to the ejaculating duct, from the ejaculating duct to the urethra. Now, you need to understand that the urethra is where sperm is ejaculated out. Urethra in men excretes both urine and sperm, while for the urethra in women excretes only urine. So what this vas deferens does is that the major job of vas deferens is to transport sperm, is not to produce sperm. So now in vasectomy, that tube that helps to transport sperm, they either block it or cut it. Now understand the difference between castration and vasectomy, because I'll be explaining castration. Now in vas deferens, in vasectomy, they block that tube that transports the sperm. So when that tube is blocked or cut off, sperm cannot be transported again. So someone that has undergone vasectomy can still ejaculate semen, but there will be no sperm inside that semen. Now for castration, they remove that testicles. They remove the testes that produces the sperm. While for vasectomy, the testis is still there, sperm is still produced. I don't know if you understand. Sperm is still produced in vasectomy, but just that the tubes that connect it to the ejaculating duct, where it is ejaculated out during intercourse, is cut off. Is either blocked or cut off. While for castration, they remove that testicles entirely, so sperm is not produced. So that is why someone that is castrated, a man or an animal that is castrated, you see them adding weight, less muscle mass. The reason why it's like that, because testosterone is produced in the testes. It's testes that produces both sperm and testosterone. And we all know that testosterone helps to build muscles. When you see a man that has muscles and all those stuff, it's testosterone that helps to build muscles and maintain muscles. So when you are castrated, you won't produce testosterone level drops significantly, because there's no production of testosterone, because the testes that produces it is removed. Why for vasectomy does not affect hormones because the testis is still there. The testis still produces sperm, so it does not affect testosterone. It does not affect a man muscularity. It does not affect the muscles. The only thing is that you won't ejaculate. There will be no sperm in your semen. It does not stop you from ejaculating. Vasectomy does not stop a man from ejaculating. It does not stop erection. Like, you have your full erection, you have your full sexual desire, sexual libido, all those stuff. It does not affect your sexual drive. It does not affect your libido. You have your full libido as a man. You have your full muscularity as a man. Just that you won't be able to impregnate a lady because the tube that transport that sperm is cut off in vasectomy. Why in castration is that they entirely remove it, like from the roots. They remove the testes. So you see someone that is castrated, they don't, sometimes they start adding, being huge, adding weight, belly fat, less muscles. They don't have muscles, they don't build muscles because one, the testis is removed, so testosterone level drops significantly. They don't, their hormones is affected. And someone that is castrated, they have erectile issues. The erection won't, they have all these erectile issues, and it affects both their libido, it affects their sexual drive. Then for vasectomy does not affect your sexual drive as a man. You have your normal full, in fact, it doesn't affect, if you tell a lady that if you don't tell a lady that you have this procedure, that lady will not know. Some men have it. For some of them that don't want to have kids, what's you about? Someone is asking a question. Please, if you have any question, you can drop it in the comment below. Is it okay to eat axe? Why would they ask such kind of question? So in vasectomy, it doesn't affect your ability, to have that sexual enjoyment you normally have as a man. It doesn't affect you from ejaculating semen. So some of you would think that if I have this procedure, can it affect me from ejaculating? No, you ejaculate semen, just that your semen will not contain sperm. And you know that is that sperm that fertilizes the egg. Without that sperm, there will be no fertilization. And if there's no fertilization, there will be no pregnancy. So some men will undergo this procedure and they will not tell their partner. If you do not even tell your partner, she will not know, because you will have your normal activity as a man. Your muscularity will be there, your testosterone will be there, your sexual drive will be there, you have erection, just that there will be no sperm in your semen. So that's the difference between castration and vasectomy. So in castration, you are, in fact, it's just as if you're a man, you are just living as a man, but what makes you a man is removed. It's totally removed, which is your testis, your testicle, and your testicle is your what they call it, testosterone is produced. So for couples that don't want to have kids again, like maybe you are done having children, you have 10 children, 7 children, 8 children, or even 4 children, as many children you want, and you don't want to have kids again, and you don't want your wife to be taking all these birth control pills. You know that birth control pills, implants, all those drugs have effect on us women. It causes a lot in our body, both hormonal changes. It can make a woman start even adding weight, looking odd, looking older. Some women can even bleed for 6 months. I've seen a woman that she had implants. I think her husband warned her not to have that implant. So she went ahead and have implants. She's not having kids. So she went ahead and have that implant. This lady bleed for more than a month. She was bleeding. Like, the bleeding refused to stop. So she was almost admitted to the hospital, because the way, as a lady, there's a way you will bleed. It will affect you now. Sometimes you will faint, particularly if you are not strong enough. So all these things are the side effect of family planning for women. So she have to go and remove the implant. When she told her husband, her husband was like, "Shebi, I want you not to put that implant." But meanwhile, they don't want to have kids. So if she did not put the implant, probably she might even get pregnant again. So for couples that are done having kids, maybe you have a lot of kids, your family are full, you don't need anything to stress your wife, you don't want all these hormonal changes and bleeding. Some women will not even see their period for 6 months, some even a year, because of implant, because of family planning. It changes hormones. Sometimes it makes them, exposes them to different kinds of issues. So if maybe you're a couple like that, you're done having kids, you can go for vasectomy, because one of the benefits of vasectomy is that, one, it is 99% effective, in the sense that it's one of the safest birth control method in the world. But you need to take note that vasectomy is not reversible. It's not something you do today and maybe you change your mind tomorrow and go back to the hospital and tell your doctor to redo it. It's not done that way. So you need to sit down first, have a rethink, think about it very well. Maybe you don't want kids again before you undergo this procedure. This procedure is not something like all this CS procedure that takes that is more painful, that has a lot of complication. No, it's a simple procedure, 15 to 30 minutes. They have done the procedure. All they have to do is just to give you local anesthesia, unlike general anesthesia. In local anesthesia, they only numb that particular area they want to operate. So you'll be awake during the procedure. In general anesthesia, they will numb the whole part of your body, so you'll be unconscious. You understand? So you'll be unconscious. While in local anesthesia, they will only say, this one say, "Hi, beautiful. Hi, I can see you. Thanks for joining my live." So in local anesthesia, they will only numb that particular area they want to operate you. They want to carry out the surgical operation. When they give you this anesthesia, it suppresses the nerves that carries pain signals to your brain. So your brain cannot interpret that pain, you understand? So it, like I say, blocks those nerves that carries pain signals to your brain to interpret pain. So in local anesthesia, they only numb that particular area that surgical operation wants to take place. You'll be fully awake. You will see everything going on, but just that you will not feel pain that period. But once that just has expired, once that period is past, you start feeling pains. So vasectomy is not like a procedure where they will give you hospital admission. No, you don't need all those things. It's something that you walk into the hospital that day, they perform the surgical operation, and you go home. It doesn't stop you from doing your normal work. Not like someone that did BBL or all those kind of surgery that you need recovery. Like you can stay months and recover, or you can stay weeks and recover. Vasectomy is not like that. You can just walk into the hospital and they perform just the surgery for you. It's a simple surgery. 15 to 30 minutes, you're done, and you can go home and do your normal activity. And one thing you need to understand about vasectomy is that it does not work immediately. It does not work immediately. So if you undergo this procedure, you are asked to wait at least 3 months. After 3 months, then you go back to the hospital again. Then they will take your semen. Remember, as after vasectomy, you can still ejaculate semen. It doesn't stop you from ejaculating semen. They will take your semen and check again if there's any sperm there. If the procedure was successful, if the operation was successful. So they will take your semen and check if the operation was successful. After it's confirmed was successful, you can live your life like that, or just know that you can't be able to impregnate a woman. So that's the difference between this castration and vasectomy. So some persons mistake this too. When they hear about vasectomy, they think that is a man being castrated. It's not the same. You still perform your normal duty as a man. You still produce your sperm. It doesn't stop your libido. It doesn't stop your erection. You have your normal life as a man. It doesn't stop your hormones. It doesn't reduce your muscle mass as a man. You have all those muscles, unlike someone that is castrated. A man that is castrated is just like a big loaf of bread. Sorry to use that word. So a big loaf of bread where the main, all those hormones are, the testosterone is removed, because it removes the surgery removes the testes where testosterone is produced. So that is it. For if you have any question, you can drop it in the comment below. So that is the difference between this castration and vasectomy. So in vasectomy, you don't really have to worry, but if you must have vasectomy, you need to think about it. You understand? Because a procedure that is not reversible, just like when someone will go to the hospital and tell the doctor, please, I don't want to have children, can you just remove my womb or even remove my tubes? Just know that such kind of procedure is permanent. It's not something that you can reverse. Although I've heard some cases where a man undergo vasectomy and it happens that later on he was able to impregnate a lady the normal way, you understand? So you need to understand that the exception does not make the rules. In every rules there will be an exception, and that is a rare case. Just like in ectopic pregnancy, because there was a period I made a live video on ectopic pregnancy where a baby grows outside the womb. You know, in ectopic pregnancy, a baby is not supposed to grow outside the womb, because how will you get your nutrients? How will you get your oxygen? Through the placenta, the baby gets all those nutrients. So if a baby is implanted outside the womb, or maybe in the tube, or maybe in the abdominal cavities, that's your liver area, your stomach area, the baby will not survive, right? But there are cases where a baby survives in an ectopic pregnancy. Medically is not possible, so that is an exception. That does not make the rules. So in vasectomies, there are cases where such kind of procedure is done, and maybe the man later on in life was able to impregnate a lady. So you need to understand that that is the exception. It does not make the rules. It is 99% effective. When you undergo this surgery, it is irreversible. They can't reverse it. So you need to think hard, think well before you get a vasectomy. Now, for men that maybe their wife have some medical issues that they can't carry a child, maybe health, there's some women that pregnancy poses a risk to their life. There's a women that once they get pregnant, their life is in line, like in danger, due to their health conditions, and maybe you are done having children, you can go for vasectomy. You understand? You can go for vasectomy. So that helps your wife not to be taking all these birth control pills, implants, or even injection, because it has its own side effect. So maybe you are such kind of couples that your wife pregnancy poses a risk to her, you can go for vasectomy. And maybe you decide to be child free, because some persons or couples, they don't want children, they don't like children, some couples though. So you just want to be child free for life, you don't want any disappointments, you just want to enjoy yourself as couples, both of you want to enjoy each other, you can go for vasectomy. Because the reason why is one of the safest birth control method is that the procedure does not affect the hormones, it does not cause any pose, it does not cause any pose, maybe your quality of life, it does not affect your libido, it does not cause any complications, unlike maybe when you allow the woman to be taking all those implants, injections, and you know very well you don't want, both of you don't want kids. So vasectomy is one of the effective way for birth control. If you have any question, my audience, you can drop it in the comment below. I'm in my kitchen now, I've not eaten this morning, so I'm just trying to see if I can get some tea to take. I'm having some bloating. So that was it for vasectomy. Some persons they are scared of it because they have some misconception about vasectomy, that it makes a man less of a man. No, it doesn't. It doesn't stop you from being a man. It doesn't make you less of a man. If you have vasectomy, it doesn't stop you from being a man. It doesn't make you less of a man. You perform your normal duty as a man. It doesn't stop your hormones. It doesn't make starts having a less erection, your body still produces sperm, but just that it can't ejaculate it out because the tube that connects, that transports the sperm is either blocked or cut. So that vas difference that collects the sperm, that transports the sperm, is either blocked or cut. So that is where it is. Okay, go and get it yourself. Some persons and they're coming, I don't really understand what you go and get it yourself. What do you mean by that? I want to make tea. I'm using I think now is 10:58. That's almost 11 a.m. over here in Nigeria. If you're joining my live, I don't know where you're chatting from, so I've not taken anything this morning. I think I just want to take tea. Let me take tea. For those of you joining my live, I'm talking about vasectomy and castration. If they are the same, for those of you that might confuse these two, castration is not the same as vasectomy. They are different, and the reason why they are different is because in vasectomy you still produce your sperm as a man. You still produce your sperm as a man. The testicle is not removed. While in castration, that testis is removed. Now, you need to understand the basic physiology of the main reproductive organs or reproductive system. Now, the sperm is produced in the testis. That is where sperm is produced. Now, after production, sperm needs to mature and be stored, right? So it is transported into the epidermis. They call it epididymis, but in short form, I like calling it epidermis. So in the epidermis is where sperm is matured and stored. Now, during sexual activities with your partner as a man, when you have sexual intercourse, the testis contracts during sexual activity, particularly when you want to ejaculate. The testis contracts. When you want to ejaculate, the epidermis contracts. When the epidermis contracts, it pushes the sperm to the vas deferens. The vas deferens is a small tube, just like the fallopian tube in women, that helps egg to meet the sperm where fertilization comes in. So now, in men, we have that small tube as the vas deferens. The vas deferens is the structure, is a muscular structure where sperm is transported. It doesn't produce sperm. It is transported from the vas deferens to the ejaculating duct. Now, in the ejaculating duct, from the ejaculating duct, it is transported again to the urethra. The urethra in men transports both sperm and urine. That long tube transport both sperm and urine. I think men's urethra is about 18 centimeter to 20 centimeter compared to women. Our urethra is smaller. That's why we are prone to infection compared to men. For women, our urethra is about 4 centimeter, if I'm not mistaken, 4 centimeter. That's why we are prone to infection. Infection can easily enter through the urethra, then enter into the urinary system. You understand? So it is where through the urethra sperm goes out. Then for castration, that whole process, no, surgery is without risk, and this talk of yours is doing more harm than good. When did I say surgery is without risk? You are the one confusing me. Okay, sorry. Okay, I got your point. Um, you're right. No surgery is without risk, but compared to some kind of surgeries, or less maybe it's from the person that performed the surgery. You understand? No surgery actually is without risk, but the risk is more lesser compared to some kind of surgeries. I don't know if you understand. Okay. Okay, you say that you know some negative and side effects of this procedure, where it has its own negative side effect, but compared to some family planning to women, because I'm kind of explaining how this vasectomy is for family planning. Is one of the safest and effective family planning compared to some family planning women takes. So women, when they take some kind of implants or injections, they can go months or even years without seeing their period, while some of them can bleed. You understand? I'm not saying that there's no complication, but we're compared to women. Like there's this married lady, she had implants and her husband told her not to have implants. So she later have implant. Remember, she's done having kids. So as she's done having kids, sorry. So it happens that the implants made her to be bleeding for more than a month. And this affected her. She almost fainted. So she later removed the implant. So when it comes to birth control, vasectomy is one of the safest means of birth control compared to women. Just that the procedure is is permanent. It's not something that you can just walk into the hospital today and tell them to remove it. It's not done that way. It's not done that way. Let me. If you're joining my life, you're welcome. So I'm trying to explain the difference between this vasectomy and castration. In vasectomy, the testis is still there, you produce testis, but in castration, the testis is removed. So in castration, when the testis is removed, remember the testosterone is produced in the testis. So when the testis is removed, the testis helps in building and maintaining the muscles. So that's why you see someone that is castrated, the man that is castrated is building more fat, more belly fat and less muscles. And in castration, it affects erectile function. You might have difficulty having erection, you might even have weak erection. So while in vasectomy does not affect erection. You have your normal erection. It doesn't affect your sexual drive. You have your normal sexual drive. Where are you from? Why do you know where I'm from? I'm from Nigeria. Which country are you from? Where are you chatting from? My tea is boiled. Let me make tea. Which country are you chatting from? Drop it in the comment below. So before you have this vasectomy, you need to think deep before getting this procedure, because it's not something that you can just decide to reverse overnight. You understand? It's not something you can reverse overnight because you just want to. So people that like that wants vasectomy are people that are done having kids. Maybe have 8 children, 4 children, 3 children, maybe any number of kids you already want and you don't want more kids. You can go for this vasectomy. Or maybe if you are couples and pregnancy poses a risk to your wife, and there's some condition that a woman would be and pregnancy can be life-threatening to them. In such kind of case, and you don't want anything like pregnancy, you can go for vasectomy. Or maybe you decide to be child-free. Some couples that might decide to be child-free can go for vasectomy, because all these implants plays a role in causes a lot in hormones and other things. So just know the difference between these two. They are not the same. Between vasectomy and castration. I want this. You want what, please? Specify what you're saying. Which part of the country are you from? Can you drop it in the comments? Someone say there is no surgery without risk. Yes, you are right for dropping that comment. There's no surgery without risk. The truth is that there's no surgery without risk, but there's some surgery that has more risk than the other. You understand? Maybe the person performing the surgery can cause some kind of issues or complications can occur. So there's no surgery without risk, but there are some surgery that pose more risk than the other. When it comes to family planning, anytime you hear family planning, it's more on women, but there are several methods, there are several ways that you can go for family planning. Vasectomy is one of the safest family planning in the world. What did you put in the tea? What kind of question is that? Okay, let me just explain. This is sugar, Milo, and milk. Just a simple tea, and cinnamon. I added cinnamon to the tea. So it's just something light this morning. So compared to some recent surgeries, vasectomy doesn't have that much risk compared to some surgery. Not like there will be no complication. There's no surgical operation without complications. So complications can arise also. Someone is saying hi. If you have any question, you can drop in the comments. Which country are you from? You have not answered my question. I'm waiting for you to answer. Which country are you from? Where are you chatting from? Let me add rice to this. microwaving it for at least 5 minutes. Just a little bit of rice. South Africa. Okay, you're from South Africa. You're welcome. I'm from Nigeria. Tell me more about South Africa. I've not been to South Africa before. Is that dreadful to do any surgery? It's dreadful to do any surgery, but to do vasectomy, I refuse this. Okay, let me get it. Let me get your point. It's dreadful to do any surgery, but to do vasectomy, I refuse to do this on patients. Okay, are you a medical doctor? What if the patient wants it? Will you also refuse to do it? I just want to know your thought on it. Is why is it that they don't normally recommend vasectomy for couples that are done having kids and they don't want kids more? Why is it that they don't recommend it? Let's discuss. Why do you say that you refuse to do it for patients? Let me get your opinion. But you're aware that some implants, pills, and injection pose a lot of risks in our body, women. Causes a lot, both hormonal imbalance. So why is it that men, when it comes to family planning, is more focused on women compared to men, where when there are other methods that someone can go for family planning, why is it that it's only for women? So I think vasectomy is more safer compared to other form of birth control or other form of family planning, not birth control, other form of family planning. For me, vasectomy is safer, particularly if the couples are done having children, you don't want children again. Maybe you have a lot of families large, or maybe your wife, or maybe your woman, pregnancy can pose a risk to their health. There are some women that have health issues that pregnancy can be life-threatening to them. So doctor will advise them not to get pregnant. So in such kind of situation, what will you suggest? Let me get your opinion. I would like to get a different opinion. I'm waiting. So vasectomy is not the same thing as castration. So some persons mistakes some of these, they are not the same. In castration, the testicles is removed, while in vasectomy the testis is still there. The body produces sperm. I recommend your country. Okay, I recommend your country takes care of medical needs of the people. Of course, they do. They do. They do. There are several methods of birth control. They have implants, they have pills, they have some injections. I'm just kind of, this vasectomy is not it's not everybody that knows that men also have their form of family planning. Like, when you talk about family planning, it's always women. Africa needs more people, not less. Africa needs more people, not less. Are we not populated enough? What do you mean? Are we not populated? Is Africa not populated enough? Only Nigeria is the populated black country in the world, so we are populated enough. Nigeria is over 200 million. So in Nigeria, you can have like 5 countries. When you look at other countries' populations, in Nigeria, you can make like 5 countries out of Nigeria, over 200 million. So I think African is populated enough. And one thing again, you have to understand that this day and age, people don't want to give birth more. Like our mothers, our forefathers, our foremothers. Some of them gave birth to 12 children. Some of them gave birth to 10 children. But this day and age, if someone gives birth to 4 children self, they are considered as if the person is give birth to too much children. So minimum 2, maximum at least 3 or 4. Some couples, once they have 2 kids, they are enough. So that is how it is now. I'm not talking about European countries, I'm talking about Africa. Currently now, people don't like giving birth too much. Like our forefathers, our foremothers that can have 12 kids, 14 children. Some of them will have 4 wives. I'm not against that. I'm not against that totally. As long as they can take good care of them, no problem. The amount of children you decide to have, that is totally up to you. If you decide to have 10 children, that's totally up to you. If you decide to have 14 kids, that's totally up to you. As long as you can take good care of them and give them the quality of life they want. It's not about having much children, it's about giving them the quality of life they want. So if you can have 2 kids and give them the best quality education, you give them the best quality of life they want, they don't have to struggle. For me, it's more better than having 7 children and some of them are dropouts, some of them they don't have quality education, some of them don't feed properly. You understand? So if 2 kids, you can take good care of 2 kids and give them the best of life, is more better than having 7 kids. Let me take my food from the microwave. So this day and age, people don't want much children. Like me, I don't. What should I be doing with 10 children, 7 children? And that's a whole lot of stress. That's a whole lot of work. That's a whole lot of work. Few kids are okay as long as you can cater for them, you can take good care of them. Understand? That's why our foremothers you see some of them looking stressed out, worn out. Some of them even look more older than their husbands because of too much stress, too much of childbirth. What is this? Okay, what I'm eating, this is rice and stew. If you're in Nigeria, you should know what this is. This is rice and stew. Our stew is made from tomato. I don't like using tomato paste to make stew. I like using fresh tomato. So this is rice and stew. Come and join me and eat. You say, may Africa have at least 1 billion people. Ah, how many billion? How many? How many? I think the world is made up of how many billion people? Is it 8 billion people? Let me check. How many billion people are on the planet of the Earth? Let me check. If African is up to 8 billion, do you know what that means? You know what that means? That means no space will be left in this continent. In this continent. I said it. I said it. The Earth is made up of 8 billions. There is enough space. There's no space. There's no space. The total Earth, like Earth, is made up of 8 billion people living on this planet Earth. So if African should be at least 1 billion, there will be no space now. Where will you bury? No, now. The reason why I think life has this way of balancing things. If now think of it, if our forefathers are still alive today, some of the land, some of the place you live, there will be no space left now. There will be no space because everywhere will be jam-packed. This person will say, it's my land, I have so acres of land, it's my own. This person will say, I have so acres of land. There will be confusion. So that is the reason why the Earth has a way of balancing things. Some persons has a way of balancing things through, giving birth, and as I'm speaking to you right now, thousands of people are giving birth. Also, thousands of people are dying also. So in this way, there will be balance in the face of the Earth. So if everyone have to live, so you won't call me uneducated. I'm not uneducated. So uneducated on how things are. Like how is things, if I may ask? How is things, if I may ask? Do you think that if everyone that is dead is still alive till today, there will be no more space now? Okay, about mortality on Earth. You can tell me more about it. I want to know. You can give me that education. Nigeria alone is populated over 200 persons living in Nigeria, one of the most populated black nation. So that population, we know what it causes in the society. Job opportunities, there are much people. But when there's a job opportunity, see thousands of people want to apply. A lot of things, you understand? So you can't, when you say African alone should be 1 billion, when the total Earth is 8 billion. Well, okay, you say it's not about too much people, but about too much to control. It's not about too much people, but about too much to control. I feel like if the world has more people, too much people, that a lot will go wrong. A lot will go wrong. Imagine if our forefathers are still alive to now, would there be space left? What will you like a 100 millions of people on the planet? Well, I don't like much population. I don't like much population. But my take on it is just on all this stuff, because I'm talking about family planning. My take is just give birth to the children that you know that you can take good care of. Some of our forefathers, they have so many wives. Some of them have 14 children, 12 children. Some of those children, they work in their farmland. So the more children you have, the more, like I say, farm workers you have to work in your farmland, and that will give you more proceeds from maybe if you farm yam, all those stuff. Or this day and age, things have changed. You understand? We have education, things have changed. Unlike then, when there is no education, the more children you have, the more workers you have in your farm. So my opinion on family planning is to give birth to the children you know you can take good care of. You can give the best of life. It's not about having much children. It's about having children that you can give quality life. If maybe it's one that you can take good care of, why not? If it's two, why not? If you have more money and you can take good care of 7 kids, of course you can. Okay, this one. But what it says, there are too many whites, blacks, Asians. Too many whites, black, Asians. I do not get your point. Are you saying that there are more whites than blacks in this planet Earth? Is that what you mean, that there are more white people than black people? Is it what you mean? Let me get your point. Okay, I told you, blame bad quality of life on corrupt leaders. You have a point though. You have a point when it comes to that. Because China is populated, right? Compared to Nigeria, if I'm not mistaken. And compared to some part of the world also. So our leaders also have a role in the quality of life we live. But I don't think but when it comes to childbearing, you should blame it totally on them. You understand? They have a role in the quality of life. But I don't think that we should blame it totally on them. We have the decision on ourselves. We are the one that will provide for our kids. We are the one that will give them what they want, the quality of life. So I believe in giving birth to children that you can cater for. Our leaders also have a role in that, because in society you are, the environment you are, also you have a way of shaping your kids, have a way of shaping your children, have a way of making